The world of medicine is constantly evolving, and with it, our understanding of diseases. This is particularly true for diabetes, a complex metabolic disorder affecting millions worldwide. For decades, we have known about type 1 and type 2 diabetes, each with its unique characteristics and challenges. Now a new player has emerged on the scene, type 5 diabetes. This newly recognized form of diabetes, officially acknowledged by the International Diabetes Federation in April 2025, has significant implications for global health, particularly in developing nations. Type 5 diabetes, also known as malnutrition-related diabetes, presents a unique set of challenges and requires a tailored approach to diagnosis and treatment. Unlike other types, type 5 predominantly affects young, undernourished individuals in poorer regions of the world. This distinction highlights the intricate relationship between poverty, nutrition, and chronic disease, underlining the urgent need for a multi-pronged approach to tackle this growing health concern. The recognition of type 5 diabetes marks a significant milestone in our fight against this global epidemic. It paves the way for targeted research, improved diagnostic tools, and ultimately, more effective treatment strategies. But perhaps most importantly, it shines a light on the plight of millions suffering silently, often misdiagnosed or overlooked. Before delving into the specifics of type 5 diabetes, it's crucial to understand the broader context of diabetes. Diabetes is a chronic condition characterized by high blood sugar levels. This occurs when the body either doesn't produce enough insulin or can't effectively use the insulin it produces. Insulin, a hormone produced by the pancreas, acts as a key, allowing sugar, glucose, from the food we eat to enter our body's cells to be used for energy. Type 1 diabetes, often diagnosed in children and young adults, is an autoimmune disease where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, people with type 1 diabetes produce very little or no insulin and require lifelong insulin injections to manage their blood sugar levels. Type 2 diabetes, the most common form, is characterized by insulin resistance. In this case, the body produces insulin, but the cells don't respond to it properly, leading to a buildup of glucose in the bloodstream. Type 2 diabetes is often linked to lifestyle factors such as obesity, physical inactivity, and an unhealthy diet. Gestational diabetes, as the name suggests, develops during pregnancy in some women. It usually resolves after delivery, but increases the risk of developing type 2 diabetes later in life for both mother and child. The journey towards recognizing type 5 diabetes has been long and complex. While the medical community has been aware of a form of diabetes linked to malnutrition for decades, it wasn't until recently that it gained official recognition. In 1955, researchers in Jamaica first described a form of diabetes affecting malnourished individuals, primarily young people. This discovery, however, remained largely confined to medical journals and received limited attention. The World Health Organization acknowledged this distinct form of diabetes in 1985, classifying it as malnutrition-related diabetes. However, due to a lack of comprehensive research and a standardized definition, this classification was later omitted in 1999. Fast forward to the 21st century, and a renewed interest in malnutrition-related diabetes emerged, fueled by groundbreaking research and advocacy efforts. Studies highlighted the unique characteristics of this diabetes form, differentiating it from other types. Finally, in April 2025, the International Diabetes Federation officially recognized type 5 diabetes at the World Diabetes Congress, marking a pivotal moment in diabetes history. Section 4. The face of type 5. Diabetes, malnutrition, and the pancreas. Unlike type 2 diabetes, which is often associated with obesity and lifestyle factors, type 5 diabetes primarily affects lean, undernourished individuals. This distinction points to a different underlying mechanism. While type 2 diabetes stems from insulin resistance, type 5 is rooted in the pancreas's inability to produce sufficient insulin. The pancreas, a vital organ in regulating blood sugar, plays a critical role in type 5 diabetes. Chronic malnutrition, particularly during childhood and adolescence, can impair the pancreas's development. This underdevelopment can lead to a reduced number of insulin-producing cells, impacting the body's ability to produce enough insulin to meet its needs. Section 5. Diagnosis, treatment, and hope. Diagnosing type 5 diabetes can be challenging due to its similarity to other forms of diabetes. However, specialized tests focusing on pancreatic function and nutritional history can aid in accurate diagnosis. Treatment often involves a combination of insulin therapy and nutritional support, aiming to address both the insulin deficiency and underlying malnutrition. Despite the challenges, there is hope. With proper medical care and support, individuals with type 5 diabetes can lead healthy and fulfilling lives. Continued research and awareness are crucial in improving outcomes and providing better care for those affected by this condition.